Hi, everyone. Welcome to Alan Hu Foundation Mental Health Lecture Series. I'm Chi-Chin Hu, co-founder of Alan Hu Foundation and host for your webinar. Today, Dr. John Ratey will present the positive impact of exercise on depression and suicide prevention. First off, I want to thank Mental Health Association for Chinese Communities for providing simultaneous Chinese interpretation. And thank you, Ida Xiao, for Chinese interpretation. Alan Hu Foundation's mission is to promote mental health, raise awareness, and remove stigma surrounding psychiatric disorders, and support fundamental research for cures. Please consider making a gift to Alan Hu Foundation by using the donation link in the chat box. Thank you for your support, our program to promote mental health. Today, it is our great honor and privilege to introduce Dr. John Ratey. Dr. Ratey is an esteemed associate professor of psychiatry at Harvard Medical School, with over 60 peer-reviewed articles and 12 books, including the groundbreaking Driven to Distraction series with Dr. Nate Hallowell. He is an authority on the brain-fitness connection. His bestseller, Spark, The Revolutionary New Science of Exercise and the Brain, solidified his expertise in autism, aging, and cognition. Dr. Ratey is committed to patient care, maintaining private practices in Cambridge, Massachusetts, and Los Angeles, California. In this presentation, Dr. Ratey will explain that exercise serves as a valuable avenue for both treating existing depression and averting its onset. He will discuss the positive effects of incorporating exercise into a comprehensive mental health treatment plan with help from mental health providers such as therapists, psychiatrists, or counselors. Following the presentation, please using Zoom Q&A function to submit your questions. The presentation is for educational purposes only and is not intended for medical diagnosis. If you have any persistent symptoms, please seek professional help. With that, I'm going to turn to Dr. Ratey.
Hello,
Dr. Ratey.
Thank you for having me. I think your foundation is really important, and I applaud it and want to support it.
Thank you so much.
So do you want me to take over now?
Yes, please take over, because I just shared the presentation, so you need to reshare it again.
Oh, I have to share it again? Oh, geez.
Yes, because I just took over your sharing earlier.
Okay. Is it on?
Yes.
Okay. Are we good?
Yes, it's on the slideshow. Yes.
Yeah. Okay. I never know how these things work with Zoom and everything. Anyway, it gives me great pleasure to be with you all. I'm talking to you from Cambridge, Massachusetts, one of my homes. As Alan said, I also have been in Los Angeles and now Honolulu and Northern Michigan for a variety of reasons, but all chasing the sun and being in situations where I'm in nature, which is so important. Anyway, what we need to remember is the benefits of exercise. They go across the board, especially affecting mood, self-esteem, confidence, and motivation to do. These are important areas of need for people who are depressed, and certainly those that have suicidal ideation. When we're talking about exercise tonight, I'll be meaning to include aerobic exercise, strength training, and balance and coordination training, all of which show themselves an effect on mood, self-esteem, confidence, and motivation. And they all lead to a sense of community, a sense of a wish to relate to others. And this is something that we see in people that are devoted to one form of exercise or another. They get together in groups. CrossFit is a big example of that. It's a huge organization that helps people really get and stay fit. But the important issue is that exercise promotes feeling well and also promotes us to want to link up with others and not avoid others. And this is very important in people who are depressed, and certainly those that are suicidal, that they want to turn away from others and ruminate and be left on their own. And this is a danger, and it just extends their depressed mood. I've written this book, Spark, which Alan mentioned. It's also translated into Chinese and 16 different languages now. But I've spent time in China, actually quite a bit of time in China, and they're very much involved in promoting exercise as a means of working with mental health problems, as well as improving cognition, as well as delaying the onset of cognitive decline. In this country, we have the same mission. Many of the schools that I've worked with over the years have incorporated exercise more into their programs to improve one's mood and cognition and socialization. What my book and my work is really been all about is that exercise itself is not just for the body. We like to think, well, it will help us lose weight, we'll get buff, we'll get more attractive and appealing. But the way I see it is that exercise's main benefit to humans is that it affects the mind, the brain, and the soul. It helps us think better, more clearly. It helps our mood to be more regular and balanced. And it helps us learn faster. 4 of my books are about attention deficit disorder, and all of them we talk about the benefits of exercise and how this helps the attention system, as well as our ability to learn and remember. But most importantly, it helps our mood, and it promotes us to be more social. So what does exercise really do? It changes the level of chemicals in our brains. It changes the blood flow. It changes our oxygen delivered to the brain, but it most importantly changes our neurotransmitters and neurohormones, especially serotonin, dopamine, and norepinephrine, all of which are boosted by our antidepressants and help us become less depressed, less ruminating, less worried. It also boosts our endorphins, which most people are aware of, that associated with increasing our endorphins. People say, I want to go exercise to get an endorphin rush, but it's not just that. It has so many other effects, including on the endocannabinoids, which are the substances in our body that are match up with substances in marijuana and marijuana substances. It's a natural high, and you combine the elevation of all these factors with exercise, and what do you have? You have an improved mood, an improved affect, an improved positivity, improved motivation. It also helps to improve our sleep, which obviously helps with mood management, and improves our sense of control and our coping ability. It turns on the front part of our brain, which is all about our executive functions, where we manage our mental resources, and improves all of our nerve cells. It makes our nerve cells more resilient and more ready to do their job, which is to grow. And this is a problem, especially in depression. We see a decrease in this ability of our brain to take in information and think or remember different ideas, different possibilities. So we see exercise as having such a big effect on all these areas. Now, this shows you what happens. This is a slide showing 20 sixth graders over on your left getting a QEEG. They come in and they sat down and they put on this pie plate on their head, which measures their QEEG, which is it's a way of looking at brain activity. They went out for a 20-minute walk, came back, and they had the same pie plate put on their head. And what happened is that the differences between before they went for a walk to after is that their brain is on fire. Their brain is more stimulated. The brain is more active. That's what the colors show. The more colors means the more activity of the brain. So it's a simple way of seeing what exercise really does. It turns our brain on. We know a lot about the benefits of exercise for mental health, all the way back to Hippocrates, who wrote the first medical textbook 300 years BC. And he said that when talking about depression, when people would come in to see him, he would say, well, if you have a bad mood, go for a walk. And if they continued with a bad mood, he would say, keep walking. Well, this is something that we've seen over and over again. And unfortunately, we have to learn it almost with every generation, that exercise has this powerful effect. Now we have studies that actually show that exercise is as good as our vaunted antidepressants. This is a study out of Duke University Medical School some years ago, where they looked at about 100 people coming in over a 3 or 4 year period to Duke who were depressed. They put them on 3 different treatments. One, increasing doses of Zoloft to help relieve their depression, to put them on an exercise program, or to have them both on the medicine and exercising. What they saw after 4 weeks, that all their depression scores dropped to about the same level. This is, this is before and this is after. There was a drop in their depressive symptoms in all groups, in the exercise group, the medication group, or in the combined group. And this is just another way of measuring depression. So we know that exercise has an effect to really change the brain. And this is one of many, many studies that have shown that. Now, this is something that I've incorporated into my lecture from the wonderful questions that Alan and others have sent me, looking at my lecture. This is from someone who said, well, what about people who have a severe depression? They have no motivation and very low energy. What steps can parents or friends take to help them gradually get into a good exercise routine? These are the steps. First, have the interested party or understand the benefits and share them with the depressed person to make them understand that exercise can have a profound effect on the way they feel. Next, explore their feelings about exercise, perhaps remembering some time when they were exercising and they weren't depressed, and maybe a happy time in their childhood, and see what their feelings are about exercise. Next, set realistic goals. The first would be, in many situations, is just to get up and move, to walk around the room, and then outside, and then around the block. But first, to get up and move. So many of our very serious depressed patients sit in the chair all day and don't want to get up or lie down. And next, the interested party will offer social support, which is so important. We call it vitamin C, or Vitamin Connect, and offer to go with them and congratulate them on moving at all. Then to help set up a routine in consultation with the patient and as to what they might do and how they might do it. The best idea is to try for some enjoyable activities, something that the person had enjoyed in the past, to get them moving and to stay with it. Next, it certainly is to start slowly. Don't overdo it, but to begin with a plan in mind as to how much they want to add to their exercise once they get going. And then to have some means of tracking their progress, whether it's time spent in various heart rates, which is a very good measure of the effect of exercise on the brain, and it leads to a good way of seeing a benefit of the exercise, but also helping to identify the changes in their mood and in their brains. Now, many people say, well, what about people that are stuck in a chair, that won't move? And this is a study really in 2005, so some time ago, where they looked at about 20 patients over the course of some years who had bipolar 2 depression, which means very thick, serious, depressed patients. They're not moving. They have no motivation. And what they did is had them just get up and walk on a treadmill with the support staff there for 15 minutes. And what they saw over the course of time, after they had their bout of exercise for the first time, they saw a decrease in all these scores, in depression, in tension, in anger, and in inner distress. And it's something that occurred 5 minutes after exercising, 30 minutes after, and then finally 60 minutes after. So this is a very important point about the motivation to exercise, a motivation for people who are so densely depressed to exercise, and people that haven't adopted exercise as a lifestyle, is for them to pay attention how they feel when they do it. It's not looking at the long term. It's just looking at the change that they have when they exercise. Now, there's lots of studies have been out. And in my book, Spark, I review 1,000 papers, not all on depression and not all on anxiety and distress, but on all the effects of exercise on the brain. Now there's this paper that came out this year in the British Journal of Sports Medicine, looking at physical activity and mental health. And what they did, and as many people do these days, many investigators, is they studied the studies and looked at 1,039 studies that fit the criteria to be analyzed, and a total participants of 128,000. And this included a full gamut of physical activity. And they found that exercise was a mainstay in the management of depression and anxiety, as well as preventing the onset of depression and anxiety. Their overall conclusion is physical activity enhances mental well-being, and it's integral to mental health management. It's important to note that while exercise can have significant mental benefits, it should not be seen as a replacement for professional mental health care and medication when needed. There's all these studies that I just wanted to mention to show how much people around the world have been looking at this, and it doesn't take a lot. This study out of Norway, looking at 34,000 Norwegian adults over a year's period, that showed that if they just exercise for an hour a week, that they reduce the percent of people getting depressed by 12%, just with 1 hour a week of exercise. And looking at this in this Norwegian population, and they made a point of saying this wasn't about very vigorous exercise. This was walking, biking, swimming, hiking, and so it didn't take a lot, and it doesn't take a lot for us to have these powerful effects. Now, so what happens in the brain? In the brain, when you exercise, you are using about 35% of all the 100 billion brain cells that we have, because our brains evolved to help us be better movers. And with that, it evolved to help us be more emotionally stable. So what happens is that when we exercise, we're stimulating our brain cells, and we, as well as in our body, we produce more of this beta endorphins, which is adrenaline, or driven the endorphins to make us feel better, to help us block pain, and it's linked to mood regulation, self-esteem, improves our pain threshold, and increases reward and motivation, increases the sense of satisfaction. And then with that is its partner, the endocannabinoids. the part of the marijuana plants that are also found in the body that have an effect very similar to the endorphins. And in fact, there's a big argument and multiple studies and investigators arguing which is most important for the runner's high, where people, have a feeling of elation as they really get into exercise. Well, both of them are important, as well as all the neurotransmitters that we know so much about. Though we see an increase in norepinephrine almost immediately, and this increases our moods, our arousal and vigilance, improves our self-esteem, improves all of the executive functions, cellular learning. And I've always said that a bout of exercise is like taking a little bit of Prozac and a little bit of Adderall, because it does the same thing. The antidepressants increase these neurotransmitters, and you get this when you have someone moving, someone exercising. And then also increasing the concentration of dopamine in our brains. Dopamine, the pleasure hormone, the learning hormone, the attention, neurohormone, I should say, neurotransmitters, not hormone, but neurotransmitters that have so much to do with attention and so much to do with pleasure, with motivation, as well as learning. It's a multifaceted neurotransmitter, but we increase these neurotransmitters almost immediately because you're using so many brain cells that cause an increase in concentration, which is what we're after when we use antidepressants and stimulants. As well, we increase our brain's concentration of serotonin. And most of you probably link good mood or antidepressant activity with raising serotonin levels, with Prozac and the Prozac revolution and all the new antidepressants that are out there, because it is so much about mood regulation, as well as controlling our impulses, our anger, or aggression towards others and ourselves, improves our self-esteem, combats the toxic effect of high levels of stress hormone, and improves cellular learning. Now, in the past 15 years, there's been a real appreciation of the effect of exercise on oxytocin. Oxytocin is the bonding hormone, the love hormone, the hormone that we get a slew of when we're in love, when we're with people that we care about. And with exercise, this increases the oxytocin concentration so that it helps generate our pro-social behavior, or our social behavior towards others. We want to be with others. We want to link up, which is, for someone who's depressed and withdrawn, is so important, and itself is such a huge avenue to make us less depressed and keep us involved with others. So it's really the way to go. So what should a person do? It's a hard thing to really say and say for every person, so obviously so personal, but in general, the idea is to get to the point where you're exercising 150 minutes a week. And by exercising here is by doing aerobic, doing anaerobic strength training, doing balance and coordination. It's something that we can do on a regular basis, and this will help prevent us falling into depression. A helpful app on your phone is a 7-minute exercise. This is 7 minutes of calisthenics you can do almost anywhere. I do it all the time when I'm traveling in my hotel room, just to get up and get moving. You do jumping jacks, squats, push-ups, led by a wonderful trainer. And it's just 7 minutes, and people can get energized, and it's a helpful tool. Then another very popular tool these days is something called high intensity interval training, which if you can get to that and you're depressed, you're going to get undepressed. And this is very quick bursts of high intensity exercise, keeping yourself going for 30 seconds and then taking a rest and repeating it. And Dr. Tabata, who's over here in Kyoto, when I was over to visit him, put this together for the Olympic team in Japan, but it's now become wildly popular throughout the world. But it also has such a powerful antidepressant and keeping one from dropping into depressive mode. What kind of exercise? All kinds of exercise: aerobic, strength training, balance, yoga, tai chi, martial arts of any sort. All of them really have a big benefit in exercise, in the brain. Also, dance. Perhaps the best exercise is dance, because you're moving, you're getting all your muscles moving, you're using a lot of your brain to dance correctly, to listen to the music, to dance with another or a group. So it's a very powerful way of engaging the brain. And that's what you want. You want to turn the brain on maximally as much as you can, because that leads to a lot of antidepressant effect of all the changes that you're making. Also, it's important, if you can get there and as you get undepressed, or even at the beginning, is to join up with others, to look for something that's fun, but that you will come back to. And that's so important. As well, it's hugely wonderful if you can do the exercise outside in nature, because nature has its own benefit on the brain and on our mood. It makes us feel more connected to the world. And mindfulness and mindfulness training, and when you're moving out in the world, you have to be more mindful as opposed to just running on a treadmill. And that leads, again, has more of a helping our mood be better regulated and help us get to a higher state of being. Now, people poo-poo walking as not being exercise, but it is getting more and more attention in the popular press and in the academic studies, showing that walking is a very powerful antidepressant, and especially keeping people from getting depressed, just to walk. And this is a study looking at 12 patients who had been failures on drugs for their depression, and fairly long depression, What they found, just for 30 minutes a day on the treadmill for a 10-day period, that six of the 12 patients had a marked response, meaning they got very much less depressed, and 2 showed a slight improvement. And certainly some showed no change, but it just shows that one can get a benefit from just walking for a 30-minute period per day. And if you can get someone who's really depressed to begin to do that, you're on your way. They're on their way. And of course, the old saw about variety is the spice of life. It's really true. All forms of exercise have a benefit on our mood. In the past 10 years, much more focus on exercise, the benefits of balance training and mindfulness that go along with yoga and other martial arts kinds of activities. To show you my high intensity interval training, what it can be like. It's not quite like that, but you just really want to go all out and stay all out for 30 seconds and then take a rest. And what an antidepressant it is. But anyway, back to the whole story. You have to look at exercise, especially with someone who is depressed, or you want to stop the depression from coming back, or if you have a depressive character, you want to stop thinking of a long-term effect of exercise. Think of it now, how you feel after you exercise, the well-being, happiness, and joy you might have after you exercise, as well as the fact that you've done it. And then all these studies showing that completing the exercise is a really powerful, positive feeling of one's self-worth. And then to make the physical activity the elixir of life, and to keep at it. And issues like weight loss and all that will come, but that's not what's important. And I think the focus now is not just on losing weight or getting buff, but on changing the brain and keeping it functioning maximally. And yeah, that just do it, the Nike, and just the feeling of getting out there and doing it. That it improves our emotional regulation, improves our mood, and optimizes our cognition. It makes us as smart as we can be when we're in a high fitness state. So we want to improve all of that. Finally, recommended for everyone, but certainly for people who are depressed or prone to depression, is to get the heart rate up. Why? What does that mean? The heart rate is a measure of how much activity your body is going through and how much then your brain is turned on, being active, stressing the brain a bit, because that then leads to all these positive effects of our neurotransmitters and neurohormones. Also, again, being with others, exercising, whether it's a solo, whether it's someone that's devoted to you to get you to move and moving with you, is so important from the really extremely depressed patient, but also in general to keep the flow going. The connection while you're exercising is enhanced and is so much, makes everything much more positive. As I mentioned, getting outside, doing your exercise outside, out in the air, out in the nature, if you can get it, because there's so much we know about the benefits of being outside. And with severely depressed people, just to get them outside can have such an effect. In Asia, especially Japan and South Korea, they have something called Shirin Roku, which is forest bathing, getting depressed patients and overstressed patients and people, both physical health but mentally challenged folks. If they get them outside into the forest, get them into nature, it has a positive benefits both physically and mentally. Lastly, to try and make the exercise fun, because you want to have it fun so that people will get it and come back to it. It's just something that we all know and we all search for, that kind of play that can be addictive. Getting, whether it's a sport or just an activity, and to help your loved one or your patient to appreciate how much better they feel while they're doing it, and hopefully being self-sustaining after they are aware of how much better they feel. So with that, I finished the presentation, and love to hear some questions. I was sent 10 questions by Alan and others that are important, I think, and I will quickly go over the answers to them. If the treating psychiatrists and psychologists think exercise is good but not essential, how do you convince them? Well, you convince them with data, and we have plenty of data to show to the mental health team if they are more or aren't as encouraging as they could be to the patients to exercise. Does exercise have positive impact on all forms of mental health? Yes, yes. And my book, Spark, looks at all the different kinds of different mental health issues, autism included, as well as ADHD and bipolar disorder and OCD, as well as depression, anxiety, and the general stresses and strains of life. Okay. Well, with that, is exercise equivalent to sport? What non-athletic kids can do? Well, it's not about sport. Sport is just a collection of exercising, if you will. And sport would be nice for everybody to be a sportsman, to be interested in sports, but you don't have to be. You exercise on its own can be just great. So for instance, dance. When we're in Hawaii, my wife and I go to Zumba in the park, which is just the most beautiful form of exercise outside, joyfully moving, trying to move correctly. I go on the Fridays where they break down the dance slowly, so that for people that are balance and coordination challenged can get involved in moving. How does an individual with chronic pain get some exercise? Well, that's a good question. I mean, it's if you can exercise a part of your body that's not full of pain, then do it using weight training or movement of the upper body. If you have lower body problems or pain there, because we know that if you do start moving in general, you will help your pain be lessened. Do individual and team sports benefit mental health differently? Yes. Was one better than the other? Maybe. Team sports. What about team sports? Well, team sports have the additional advantage of being connected to others, of having the encouragement and the monitoring by others. Just to you have to show up because it's time for practice or it's time for a game, and so it really helps one continue to exercise. And then if you really get involved and you want to get better, well, you go into training, and so that's a plus for sport. But individual exercise is really what you're all going to be individually exercising all the time, even in sport, but it's harder to do on your own without some tie-in with others. What daily exercise and how much it will help prevent depression? There isn't a magic number or a magic heart rate or a magic exercise, but we use 30 minutes a day just because it's a round number. They did studies showing that people that exercised 16 minutes a day did better than those that had a much better effect on depressive scores than those who only exercised 8 minutes a day. So whether it's 16 or 30, it's impossible to really say. It's something that you will do and come back to again and again. What's the difference between walking and running in terms of helping someone with ADHD to focus better? I'm a runner, but I find that I focus better when I am walking. Well, when you're a runner, you are using a lot of your oxygen in all over the brain, and perhaps going beyond what is necessary for feeding all your brain cells. When you're walking, you're stimulating, again, all your brain cells, and especially those that are involved with focus, but you're not overdoing it. And when you overdo it, perhaps the focus is less good. And how does someone with injuries such as back injury get some exercise? That's where you consult your physical therapist to help you come up with a strategy to retain exercise. I mean, someone with injury who is put down, the big problem is that they stop moving as a whole, and this can be really problematic. So now we have other questions.
Thank you, Dr. Ratey, for a wonderful presentation, and also you already answered some of the pre-registered questions. So let me start some more questions the audience just submitted. Next one is, will strength training type anaerobic exercise also have the same brain growth function as cardiovascular exercise?
They all do. I mean, that's the beauty of where we're going now. Looking at strength training, balance training, all have a push towards our brain growing. They all cause our brain cells to release many factors, and one I didn't talk about is BDNF, or brain-derived neurotrophic factor, and that's that is the fertilizer for the brain. And all cells, all your brain cells acting will cause a release of this factor, which makes our brains better able to grow and change, which is the way we learn. So they all have a part to play, and it's aerobic is just longer and easier studied because we've been looking at rats and mice and be able to measure stuff in them that we can't in humans as well. So, but it's hard, it's easy to get them to run, but it's hard to get them to do a yoga pose. It's hard to get them to lift weights and do strength training. However, that's being done, figuring out ways to strength train a rat. It's being done and shown that the effect on the brain is very similar to those rats that are running.
Okay. Next question, I think it's for us, will the slides be available for download? This webinar has been recorded. We will put it up to Alan Hu Foundation website and also Alan Hu Foundation channel on YouTube a few days later. So you may come back to check it. And we will also send out the email with news and notes to remind everyone. Okay, so next question, why would the combined group not be as low as the other two groups, 1 medication only, 2 exercise only, 3 medication and exercise?
Yes, everyone asks that question, and I love it. And this wasn't a huge study. There was only 100 people. So 30, 33 in each cell, each group. And there were a couple people in the combined treatment that had people that were had a recurrent depression during the study, and this dropped the score. This dropped their improvement greatly, and that's why you saw the combination not being as effective as drug or exercise alone.
Okay. So next question. How much better is the effect of exercise if it is combined with simultaneously intellectually challenging the brain?
So much better to do both. That's why I mentioned dance, martial arts, other forms, and most sport, where you're focusing, you're making plans, you're changing your movement while you're moving. Well, think about what this means. What your brain is more on fire, and that's what you're after in changing the brain, is to get the brain super active as you can, and exercise does that. But also thinking, planning, changing the plans, changing your focus also has an effect on having your brain cells be much more active. Now, one study that I didn't mention that is fantastic is looking at creativity. Creativity, they did this study at Stanford on 200 students and found that the idea was that if they did a 10-minute walk, afterwards they'd be much more creative. And so they used people before, during their walk, and after their walk as measures to see which was more creative. Well, in fact, those that were walking during the act of walking were most creative. It was true that those that had walked were improved over those that from their baseline, but while they were walking, they got the most benefit. So there's so much that we know that, activating the brain has so much power in changing the way we look at the world.
Okay, next question. Could you please give us the references to the data supporting it, bibliography, perhaps? I guess maybe Dr. Ratey, you can send us a link, maybe we can forward it out.
Now, what is the question? I'm sorry.
Could you please give us the references to the data supporting it?
Okay.
Bibliography, perhaps?
Yeah. Well, you get my book, Spark.
Yeah.
There's 1,000 references with Spark. So, and they're dated somewhat 2008 or so, but it's still quite current. And there are a lot of references that I'd be happy to send you. I'll send them to you, Alan, and you can share them with everyone. It's on my website, but
okay. Yeah, we definitely can find it. Yes, this is no problem. So next question. For the brain specifically, is there too much exercise?
can you overdo it? Yes, you can overdo it. As the runner who asked the question about or made the comment that their ADD was better when they were just walking, that when they were running, their attention wasn't nearly as good. It shows that there's an overwhelm going on. That's not necessarily the case, but it certainly can be. And what you can do is when you get really, really active, and they did this study at the people racing in the Tour de France. These incredibly fit people, men, when they got over an hour and 15 minutes of intense activity, what they showed is that they were beginning to really increase a lot of cortisol or stress hormone. Even though they were in a high degree of fitness, that was for them, that was too much. And it just represents what it can be for all of us, that we have, there are limits, but most of us aren't going to reach that, where it's too much. But it's always the worry that we're going to get addicted, or there's too much there's too much stress. But for the average person, it's not a worry.
Okay. Next question, is it true that consumption of cannabis lowers existing levels of endocannabinoids? In other words, would marijuana consumption of someone who exercises regularly hurt or help their mental health?
Yes,
Symptoms?
especially in today's world, that's a very important issue. Yes, yes, it can lower the response, the innate response. If you're continually bathing your endocannabinoid system with marijuana, then you have less drive, if you will, or you won't have the same kind of change that you would in someone who is not using marijuana continuously.
Okay. Is the effect the same for people who have treatment-resistant depression?
Yes, in fact, yes. Yes, in fact, one of the major ways of helping treatment-resistant depression that are on medicine or whatever, is adding exercise to their regimen. In fact, in the scheme of things, the psychiatric community had been very passé about exercise as a treatment for depression, until one of the leading lights in psychopharmacology also began to study the effect of exercise on refractory patients. I showed a slide of the walking. It was one of the studies, that many of them showing that walking or exercising can be a help in dealing with refractory depression.
Okay. Does listening to audiobooks and or listening to music while running, jogging count as a more complex brain activity?
Certainly, both of them will help. One will help you continue to exercise. Many of my friends and patients use listening to books or listening to music to help them continue with their exercise. That's number one. Number two, yes, it does count as an intellectual activity. Mm-hmm. So you are stimulating, you are using more brain cells, which is what you're after.
Okay. Are there age differences as to how much people respond to exercise? Age differences.
Yeah, no, I get the question. That's a very good question. I don't want to say, because I don't really know whether we have studies that looked at that. We know have lots of studies looking at the elderly exercising, and they seem to be able to, and willing, if they can do it, to get up to the same amount of exercise, the same time, the same endurance, the same strength, attempts anyway. There's certainly limits as we age, but so I have, in my longer presentations, I have a slide showing an 80-year-old man who had never exercised, and then he got depressed, and his doctor said, start running. And the second slide of him is at the age of 100 finishing another marathon. So he went from no exercise to running marathons starting at the age of 80. So one can really get there if you do it reasonably.
That's really amazing. Okay, so we're about the time. Let me ask the last question. What level of activity can get people started who resist, refuse, even walking?
Well, they study, what I would recommend, it comes from working with very obese patients who are like that, who don't want to move and won't move. You get them, in the same way with people sort of wedded to the chair. If you could get them just to use a small weight to do curls or to do lifts, to get their muscles moving a little bit. You really want that activity going. And then hopefully that can lead to them wanting to do more.
Mm-hmm. Great. Thank you so much, Dr. Ratey, for sharing your knowledge with us today, and the wonderful Q&A, very, very useful information to us. And yes, I also want to thank everyone for joining our webinar today. And we hope to see you again in the next webinar on October 24th. UCLA Diana Winston will lead a workshop on mindfulness practice. Please take a moment to fill out a short survey. I will leave the donation QR code for a few more minutes. And thank you for donating to support our programs. With that, I'm closing the webinar. And thanks, everyone. And thank you, Dr. Ratey.
Good luck to you all.
Bye. Thank you. Goodbye, and take care, and stay well.